Welcome to the latest edition of the Mind-Gut Conversation. Today, I had the pleasure to talk to Dr. Alessio Fasano from the Massachusetts General Hospital in Boston. Dr. Fasano is the W. Ellen Walker Chair in Pediatric Gastroenterology and Nutrition. He's Division Chief for the Pediatric Gastroenterology and Nutrition and Director of Center for Celiac Research and Treatment. He's also the director of the Mucosal Immunology and Biology Research Center at the Mass General. He is a leading international authority on the topic of gluten-related disorders and the author of a widely praised book about all aspects of gluten-related disorders called Gluten Freedom. The nation's leading expert offers the essential guide to a healthy gluten-free lifestyle. Welcome to the show, Dr. Fasano.
Thank you for having me.
So let me start out with a very general question. When I went to medical school, celiac disease was a relatively rare disease in children, which presented with failure to thrive and complications of malabsorption. Today, the picture is quite different. Gluten has become a household name, and millions of people try to limit their gluten intake or avoid gluten altogether. How did this change happen?
It was a dynamic process, so to speak, because again, when celiac disease was described the first time, it was perceived a pediatric condition that destroyed the intestine. We didn't know why. At the beginning, we didn't even know what was causing this. And eventually, because of the intestine not working properly, the outcome of the disease was going to be maldigestion of foodstuff that will go through, bottom line, and with that malabsorption, and therefore the classical picture of celiac disease was, the kids with a big belly, no subcutaneous fat. In other words, malnourished kids that we see now from third world countries, but they are malnourished because they don't have food. These kids, they have all the foods in this world, but cannot make use of it. Over time, the disease has been radically changing the way they present itself. First of all, with age. Now, you can develop the disease at any age, even if you're 85. That even if the landmark is still the destruction of the intestine, now we know to be an autoimmune process. Symptoms that can go well beyond the GI tract, so it's what we call a systemic disease. There is no tissue organ that's spared, and has comorbidities with many autoimmune diseases. So meaning that it's pretty much in the same kind of group or category of diseases that has been changing over time. So it's not just premise of celiac disease, but many other autoimmune diseases are changing the way that they present itself clinically. The reason are not completely understood, but probably because, not because of the genetic component that's been the same, but the environment that really leads to celiac disease, besides gluten as the trigger that was discovered during World War II. Other elements of the environment may change really the clinical outcome, and therefore makes this a sort of clinical chameleon.
So, do you think this increase? I mean, there are these, these classic images of a whole variety of autoimmune diseases increasing over the last 60 years. Would you count celiac disease as part of the same underlying process that we just see this, general increase in autoimmune diseases, possibly related to failure of early training of the immune system to recognize or to differentiate between self and non-self?
Yeah, I mean, epidemiological studies from our group and many others seem to suggest that, celiac disease shows the same epidemic, trend that other autoimmune diseases like diabetes and multiple sclerosis and rheumatoid arthritis have been showing the past 4 or 5 decades in industrialized countries. And again, this is another sign that we're changing the environment too fast for us to adapt, because, the timeline is not, compatible with genetic mutation to explain these epidemics. It's rather than, again, the environment, the second key component that leads to autoimmunity, has been changed so radically that, as you mentioned, we're not capable to really give the immune system the capability to mature and understand, when to unleash inflammation to defend us, or when it's trivial, it should not be done.
What percentage of people that have celiac disease, based on positive blood tests or mucosal biopsy, have symptoms? Or asking the other way around, I mean, how many are asymptomatic?
A fair amount. We discovered this by this epidemiological study in first-degree relatives, that by definition, because of higher risk, we routinely screen when a family member is diagnosed with celiac disease. And we discovered that, almost 30–40% of people with celiac disease, they don't have symptoms. And, again, this is also based on some general population tests that have been done on, non-at-risk, individuals like school children that were screened routinely to find out, what was the prevalence of celiac disease in any given country. And we realized that a fair amount were asymptomatic. Now, this should not be a surprise because, again, if the destruction of the intestine is the long tube that, average between 10 and 20 feet long, is limited, and that part that is inflamed, it doesn't do anything specific, the rest of the intestinal tract can really compensate, and you don't develop symptoms. But as the damage progresses to a critical point, you will be put over the edge and you will become clinically apparent.
There's a particular patient that I saw, and I would like to get your opinion on that. So it's an individual, actually a physician, who never had any gastrointestinal symptoms, ate a completely normal diet until he had a routine blood test done for celiac disease. He wasn't sure why that was done. And he was told by his physician to go on a strict gluten-free diet, which he did. When he was traveling in Europe, he wasn't able to stay on his strict diet for 2 days and became violently ill. He becomes so sensitized by this experience that he's now paranoid to travel anywhere out of fear that such an episode may recur. And actually, he has had recurrent episodes like that. So an individual that was completely asymptomatic, celiac disease or marked celiac disease detected on a routine blood test, went on a gluten-free diet, and then he basically developed severe celiac disease, symptomatic celiac disease. How do you think that's possible?
This is not surprising at all. Actually, I would say this is the routine and not the exception. And the reason why it's only partially clear to us, but the bottom line is that, once you are diagnosed with celiac disease, that means that there are some immune cells that have been primed to go after gluten as the culprits, and when they're exposed to gluten, they eventually induce inflammation, create inflammation. When you become naive for gluten, these cells will stay around, will keep memory of this encounter. It's sort of principle like, the vaccine, but they are programmed that if exposed again to the enemy, quote unquote, that have been primed against, in this case gluten, they will go all in, and they will definitely not build up, gradually that immune response. This is not least in some individuals because there is, interperson variability, and you may eventually develop symptoms because of this severe inflammation that's built up by these immune cells that keep memory of being primed against gluten. Even people that they have symptoms, for example, have been, symptomatic, and that's how they were diagnosed with celiac disease, and they go on a gluten-free diet. When cross-contaminated, they can develop symptoms that are completely different to the starting symptoms. So maybe that's, abdominal pain brought them to the diagnosis, but eventually, if exposed, they have, joint pain, or, they have violent headaches, or they have, skin rash. So this is all possible way that, the immune system reacts when re-exposed to gluten, which they were primed against.
Very interesting. Let's move on to another group of gluten-related disorders. So these non-celiac gluten syndromes. Let's start with the first one, wheat allergies. How big a medical problem are wheat allergies, and have they also increased in prevalence?
Yeah, I mean, it's definitely there. It's, wheat is among the top 6, 7 allergens, food allergens that, we deal with. And again, like any other gluten-related disorders, even wheat allergy seems to be increased over time. Depending on the age, the prevalence can change between, 6, 7% in kids to 0.2, 0.3 in adults. But it's not a trivial problem there. And again, I believe that this increase, like for celiac disease, it's a mix of a true increase because, again, as I was telling you before, the immune system has not been given the chance really to be trained to decide if and when unleash inflammation, but also because increased awareness. So people that were not looking into with allergy in the past, and now they're a little bit more attentive. And the combination of the two seems to be, responsible for this, increase in with allergy as well.
So you would say that this increase in the variety of allergies in the last decade even, I mean, I remember, well, I can't remember in medical school ever having heard about peanut allergies or wheat allergies. Today it's in everybody's mouth.
Yeah. I mean, the peanut allergy, I believe, is the quintessential example of how we are responsible for these epidemics. And again, there's been a recent paper that was published that really changed the entire landscape of the way that we think about food allergies in general, using peanut allergy as an example. When we start to have peanut allergy in the radar screen, and again, like you, I don't remember that this was such a big deal, but when we start to really, appreciate that this was an issue that can really affect, and in a severe way, with anaphylaxis. So, and it was this, major media, frenzy showing, depicting these cases that were, fatal cases because of some overlooking at, food in cafeteria school and that kind of stuff. We were told the best way to manage this is really to delay as much as possible the introduction of peanuts in our diet. So again, we give it the time of the immune system to mature and know how to handle that. And the consequence of this has been, or at least, this change in practice was paralleled by the paradox increase in prevalence of peanut allergies over time. Now, this apparent dichotomy and this conundrum seems to be resolved by a study that was published, last year in New England Journal of Medicine that made a big deal in the news from a group from Israel that, pointed out, said, we don't see these epidemics. And by the way that we handle, weaning the kids is to give right away products that contain peanuts. So we're wondering if that's the reason why you guys see these epidemics and we do not, because, educating the immune system to deal with some food allergens, maybe will require early exposure so that the immune system starts to really build tolerance rather than postponing. That will create the syndicate for immune reaction rather than immune tolerance. And long story short, this paper seems to suggest that's the case. So you see how we are the ones that cause the problem.
Yeah, and it would almost fall into the same category of the extreme hygiene and frequent use of antibiotics that we do early on in life, because we're not thinking about the long-term consequences, how this affects the efficiency and the accuracy of the immune system later. So I don't know if in general in Western countries or in the US particularly, mothers have, I mean, now I would think this is actually quite common because everybody's afraid that their infant may develop this allergy to avoid it early on in life. And the same thing may be true about wheat. So yeah. As you said, we do exactly the opposite. And
again, I'm a little bit biased here, but I truly believe that the general, a common denominator of all these epidemics is that, again, we're too clean for our own goods. I
Yeah.
mean, again, don't get me wrong, implementing hygiene and vaccines and antibiotics, change completely and dramatically for the better. The landscape, increasing our, life expectancy, doubling it pretty much in the last century. But I believe that we went too much in the extreme because, as usual, there is a middle ground that it makes more sense. And going to the extremes, what we did, we really stopped the acceleration of this infectious diseases, so we don't die fast of infectious diseases anymore. But we die slowly of chronic and inflammatory diseases. They are the consequence of not allowing the immune system to learn. Starting with germs and then food allergens and so on and so forth about the surrounding and make that decision-making process. Should I fight or should I stay put? And if you are not exposed, later on everybody becomes an enemy, no matter if we talk about a germ or wheat or peanuts, and the immune system has been built that way. I keep saying that the first 1,000 days of life are crucial for that learning process. And, if we don't play the cards well and we let the immune system understand if and when it's time to unleash inflammation, during these first 1,000 days, the outcome of that is that, the immune system is not, trained the proper way that's supposed to be trained, as evolution of 2 million years will have taught. And now it finds itself in a totally different kind of landscape and, just fights.
So do you think, it's always hard to predict the future, but do you think, unless we really respond to this properly, to this challenge, that we'll see a continued increase and increase not just in terms of severity, but also in percentage of the population that will develop these allergies?
I think that if we don't learn the lesson and make the adjustment that is necessary, really to slow down and eventually stop these epidemics, I don't see, how they will slow down by themselves. Again, history taught us that that's the case. And I believe that it will be unwise on our hand to not learn the lesson and change, the practice. Again, I'm not advocating, that we don't use antibiotics anymore or we stop using vaccine. That will be absolutely inappropriate. But to use them when it's necessary. So, for example, the first 3 years of life, the use of antibiotics, it's very rare because the vast majority of infections in that age are viral infections that by definition do not have any return on investment using antibiotics. And of course, vaccines are absolutely necessary because we see what is the consequence that we pay if we stop vaccinating our kids. That will be an even higher, travesty. But easy fix would be to allow the kids to go out and play in the backyard and put their hands in the dirt, as we've been doing for millions of years, rather than don't allow them to eventually be exposed to the variety of environmental stimuli that help the immune system to stay strong and defend us rather than attack us.
Okay, well, let's move on to the third of these gluten, the non-celiac gluten sensitivity. So in comparison, celiac disease or wheat allergies, this seems to be a more controversial topic, but one that apparently affects millions of people in the US. Do you believe this is a real disorder?
I do, and I have to say that I was skeptical myself at the beginning because, again, the way that this non-celiac gluten sensitivity came into the picture, again, because it was already described in the 70s and then mid-70s, and then we completely abandoned it and forgot about it, is because with the increased popularity of, and awareness about celiac disease and the increased popularity of the gluten-free diet, we kept having people come into our clinic. They claim and blame that they were sick because of gluten, and when gluten was excluded from their diet, they felt better. And we, at that time, were operating based on our rules. The rules were, if you don't have celiac disease, you don't have business to be on a gluten-free diet. So once we ruled out celiac disease in these people, we recommend to go back on a regular diet because, you know, they would not have any return on investment or any improvement in their symptoms, other than placebo effects, in staying gluten-free. And again, because of the popularity of the gluten-free diet, and of course the mass media on one hand, the internet on the other hand, you know, people, they kept coming on big numbers in clinic until we had to really look into this more, you know, how to say, objectively. And I have to say that, you know, we end up to find out that there is such a thing. The mechanism is slightly different from celiac disease. So in celiac disease, there is an autoimmune process in which the adaptive immune system comes in and kicks the chain of events that leads to the autoimmune insult to the gut. Here, there is no adaptive immune system involved. Rather, it's just the innate immune system. So in other words, the part of the immune system that we deploy early and immediately when under attack, and doesn't cause, of course, you know, any kind of inflammation that destroys the intestine. But the symptoms are very similar and overlapping. So the bottom line is that, you know, there is such a thing. I don't think that it involves millions of people because, again, this is a mixed bag of individuals. I can make the argument that, you know, if you go gluten-free, you really embrace a more healthy lifestyle because you can't eat junk food, you can't, you know, use and abuse of stuff that you don't cook. You got to be careful, you know, if gluten is in there, that means that you have to scrutinize everything. Best thing to handle that is to cook by yourself. So in other words, go back to old lifestyle, and just that can improve your symptoms. Nevertheless, to eventually, you know, negate the existence of such an entity will be negating the evidence that now I believe is building up pretty strongly in the scientific community and the clinical community.
So why do you think it's become such a big problem in the last 10 years? So is that just a greater awareness that people now, they never thought about this when they had non-specific symptoms?
I think so. I think that most of it is due to an increased awareness. You know, keep in mind that these people were labeled IBS, fibromyalgia, hypochondriac, depressed, you name it. And, you know, again, they have that symptoms, you know, completely, if not completely, at least, you know, significantly improved by, if not completely resolved, but significantly improved by going gluten-free. And again, you know, because this gluten now is so popular, and therefore the awareness of, you know, what gluten can do to you, of course, you know, give the momentum for people that at that point they give up because they have no answer why they have symptoms, to either seek advice from a healthcare professional or, unfortunately, and that's a frequent scenario, to take the matter in their own hands and give it a try on a gluten-free diet. And they seem to feel better.
There are currently no agreed upon biomarkers to make a definitive diagnosis, and several control studies, not all of them, but several have failed to clearly identify gluten as the offending agent. It's obviously a big problem because of the overlap with IBS, to really know, does somebody have this non-celiac gluten sensitivity or the functional GI disorders? Would you agree with that?
Yeah, absolutely, I do. And you know, just keep in mind, true, the major conundrum about which we can't make sense of anything here, from you know, diagnosis to epidemiology, so count how many people are really affected, is the lack of biomarkers. And you know, I want just to refresh the memory of people that may not have seen the, you know, history of celiac disease. This is like celiac disease 30 or 40 years ago. We didn't have biomarkers. There were even people skeptical that the real existence of this entity, they considered to be more a tropical sprue, so an infection and not, you know, an issue related to gluten and so on and so forth. And it took 30 years to get biomarkers. And until we didn't got that, celiac disease was a mixed bag of stuff that, that really were celiac and others that, mimic celiac, but celiac was not. I believe that we are facing the same kind of scenario here. Because the symptoms sound vague and non-specific, and, IBS is one of them, but the chronic fatigue, the headache, the joint pain, all 9 yards and so on and so forth. If we want to go through the laundry list of causes that give those kind of sign or symptoms, we'll still spend the rest of the day and tomorrow going through this list. This is not like diabetes. You drink a lot, you pee a lot. It can be anything else about diabetes. This goes lateral and vague. So and that's the reason why, it's such a challenge. Now, if you want my personal opinion, is gluten the culprit of this? I believe that it is. Is the only trigger that eventually can give you non-celiac gluten sensitivity? I'm not convinced that is the case. Probably there is something else in there. There are other proteins like these ATIs, or amylase tryptase inhibitors, that seems to be involved in this autoimmune process. And who knows what else is in there? The ones that really create a lot of confusion, in my humble opinion, is the FODMAP. So this fermentable oligosaccharides that, some people claim to be responsible for non-celiac gluten sensitivity. And while for the IBS component, this can be definitely the case because, this sugar creates symptoms because they are fermentable. And when ingest in large amount, they got in the colon, and the fermentation of the sugar will produce gas. And with that gas, distension, irregular bowel movements, cramps, all the symptoms that characterize IBS. That will not explain the extraintestinal symptoms that these people experience. They are purely on an immune basis. So that's an immune reaction that gives inflammation. So, that makes a huge difference between what we call a food intolerance, like food map intolerance, in which that's what we're talking about, and a food sensitivity, like in this case, in which there is an immune component that is creating inflammation that leads to symptoms. So this is a long way to answer. I don't think that gluten is the only culprit of the symptoms to these people, but I don't think that FODMAP is the driving force.
Okay. Quick answer to this question, along the lines of your previous answer, do you think there's any evidence to support benefit of a gluten-free diet in certain psychiatric disorders, such as autism spectrum disorders, anxiety, or even schizophrenia?
I do. And the reason why I believe that is the case, because, we have published, now extensively the evidence that there is such a thing. But even forget about our data. If you look into the literature, and probably one of the most controversial, debates in the autism, field, for example, is usefulness, the return on investment on embracing a gluten-free, casein-free diet. And here you find a very, animated dichotomic discussion between the believers and non-believers. The believers that they think that everybody should go gluten-free among kids with autism because they will benefit from that, and non-believers that, they think that this is not going to make any difference. To the point in which the NIH stepped in and the FDA as well. I said, let's do this right. Let's do this in a double-blind fashion. Let's do a Cochrane analysis and so on and so forth. And the outcome of that was, as expected, I believe, that was inconclusive because some studies confirmed some benefit and some studies negated the benefits. The reality of the story, and I believe that's, again, my very personal opinion, is there is a tremendous confusion or the level of expectation of the gluten-free diet as the panacea to resolve anything. We do know that is the culprit for celiac disease, and therefore we expect that 100% of people with celiac disease going on a gluten-free diet will benefit. But when we talk about other conditions in which gluten can be the culprit, I would be extremely skeptical to believe that 100% of people with schizophrenia or autism or ADHD will benefit a gluten-free diet. These are complex conditions. The final destination can be the same, but you can reach that final destination in a very different way. I give you an example again on autism. We know, and this is not controversial, it's well accepted, that Fragile X can lead, among other stuff, to a clinical outcome that is out of this spectrum disorder. In somebody with a Fragile X, you put that person on a gluten-free diet, there is no way that that person's behavior will improve, because there is a genetic reason why they have that kind of symptoms. All this to say, and this is the future of medicine, in my humble opinion, that we really need to do a 360 degrees turnaround in terms of how we approach medicine. 4,000 years ago, when this became a science more than an art, the doctors at that time, I'm talking about the Chinese school, I'm talking about the Arabic school, the Jewish school, the Greek school, the Roman schools, they were healers. Why? They were focused on individual. And then, over time, we moved from that to the evidence-based medicine that was focused on disease. And again, there was a necessary passage because we learned so much about, conditions that can make us sick. But now we realize that, again, these are final destinations that can be reached by each of us in a different way. So bringing now the concept of personalized medicine. So yes, you are affected by autism, but the treatment and the management needs to be managed on you, because your path to get there can be different than mine, that I got to the same final destination that you went, but through a different path. So going back to the gluten-free diet, evidence suggests that roughly 20-25% of kids with autism may have, reached this final destination through exposure to gluten. And therefore, only those 20-25% will benefit the gluten-free diet. The studies that negate the usefulness of the gluten-free diet, they took the all-comers. And if you look at the random chance, assuming that you have efficacy in only 20% that looks like, and you take 100 kids, and 20% efficacy means it doesn't work. But if you have biomarkers that we unfortunately don't have, that will say that individual reached the final destination to gluten, and put that people only on a gluten-free diet, so those 20 out of 100, now you have 100% efficacy. And the same applies to schizophrenia. So once again, it's a long way to say, I do believe there are some groups of individuals that they have neuroinflammatory conditions, they are triggered by gluten. But making from that statement the conclusion that everybody will get better going to gluten-free diet, it's something that's not defendable in my humble opinion.
Well, thanks. I mean, this was really, really thoughtful answer, and I think it's probably a good way to conclude this this conversation. I think people are interested in this topic will get a lot out of this from somebody who really has studied this and has an objective opinion on it. There's obviously a lot of voices out there that have, like in many areas now, that are sometimes called, fake science, or people making money on recommendations that are not really evidence-based. But I think hearing this from an expert like you that's a whole different story. And I'm glad we had this conversation. Thank you very much.
I appreciate that. And that's the reason why we decided to write for Gluten Freedom, to set the record straight. Because as you said, without names or pointing fingers, there are publications out there making these claims. They're very confusing, not evidence-based. They raise expectations that will be difficult to really fulfill. So with that book, what we decided to do is just going through people that live the story from the beginning to nowadays, to be objective, and and to say this is what is a reasonable expectation, and this is wishful thinking that probably is not going to materialize.
Yeah, I would highly recommend anybody interested in this topic to read your book, and I think a lot of people will get very valuable advice from that.
Appreciate it.
So thank you very much, Dr. Fasano. Really enjoyed this conversation.
Thank you. So did I. Thank you for having me on your show.